Good afternoon. It is wonderful to see you all here. This is a tremendous and important effort. Thank you to Jane Doe Incorporated for inviting us to join all of you. It is our privilege and our honor, and for the incredibly hard work that you do and you've done to make this day happen and to make this effort have voice and be strong and continue and keep all of us accountable together. Thank you to Governor Patrick for chairing this effort, for his leadership, for making the state accountable, for making each and every one of us understand the importance of these efforts, and to the Speaker when he arrives for allowing his leadership at the legislative level, and for Secretary Polanowitz, who is clearly a leader in giving voice. Obviously, as a healthcare provider, to understand this is basic prevention. This is what we need to do in creating a healthcare system that works, in understanding that these efforts are as powerful or more powerful than any vaccination, than any treatment, for us to be able to reduce harm on an ongoing basis, to make certain that we eliminate violence against women. As a healthcare organization and as an employer of more than 60,000 women and men, we understand that we all together, every aspect of this community, must be partners in ending violence against women. We, like all business leaders in the city, are responsible for creating and supporting cultures of respect in the workplace that value each person's capabilities and their health. We strive to do that at our offices, at our hospitals, at our clinics, at our health centers each and every day. If we don't care for ourselves and our employees first, how can we possibly serve our patients and our communities with caring and compassion? Our people are the very essence of what makes us great. They are the heart and soul of what lifts us to a standard of excellence with their creativity, with their energy, and with their innovative spirit. And at Partners, our institutions are filled with some of the most magnificent and brightest nurses, doctors, researchers, healthcare professionals, people at every level in providing service, in working together to really cherish and bring our mission forward, from right in our backyard in cities and towns and everywhere around the world. Our community cares for one another, trying to make the culture of our organization healthy, supportive, and nurturant environment. Our dedicated employees in human resources and our employee assistance programs offer assistance with all kinds of family and work-related issues, and as well as behavioral and mental health challenges. This kind of work and support is imperative to be able to make our people and our institutions strong. This culture and the leadership on this issue is created at every single level in our organization. For example, the Men Against Abuse Committee at Massachusetts General Hospital engages men to raise awareness and to say no, absolutely no, to violence against women. We can all be inspired by this leadership and by your great work. Our employees across the system, many of whom are here today, are working to provide pathways to safety and security for so many women each and every year, whether they're our own coworkers, our patients who come to our health centers, or the people who we meet in our communities, in our hospitals. At Brigham and Women's Hospital, violence is appropriately considered a public health issue, and there's an issue of health equity as we face to reduce healthcare disparities in our communities. Dedicated health workers are reaching deep into our communities to connect with survivors and family members to construct safety and wellness plans. While at the General, employees are providing services for patients, their colleagues, and community members who are experiencing intimate partner violence. Similar outstanding efforts are happening at Newton Wellesley, at North Shore, at McLean. Our mission is to provide the very best care possible to our patients in all of the communities that we serve. The communities here in Boston and in Massachusetts, and communities throughout the world, in South Africa, and Haiti, Rwanda, and Lesotho, and Malawi. It is the way in which we can make our communities and our world better every day. Doing this work requires collaboration. We value our relationship with Jane Doe Incorporated, with the state's coalition against sexual and domestic violence, and are proud that 3 of our programs, the Passageway, Haven, and Newton Wellesley's programs, are members of this coalition. We are honored to take part in today's White Ribbon Day campaign. Together, we can prevent and eliminate violence against women. Let's all work together each and every day. Thank you so much.